Growing through life can come with many beautiful challenges, such as experiencing hair loss. So in today's video, we are going to talk all about alopecia and of course, giving you different hairstyles that you can use to still help you feel beautiful on the inside and then on the out. Welcome and welcome back everyone. It is Kayla, your favorite beauty blogger, and we are here with Private Label. You guys are not alone. So in honor of that, today's video, we're going to be talking all about alopecia, so stay tuned. Unfortunately, or fortunately, depending on how you look at it, hair loss can happen to any and everyone. But don't you worry, we've got you covered, literally. Let's review everything that you need to know about alopecia and hairstyles that you can rock to still feel beautiful despite your hair loss. And always remember, your hair does not dictate your beauty. So what exactly is alopecia? Alopecia is the partial or the complete loss of hair from where it typically grows on your scalp or even your body. The most common forms of alopecia are alopecia areata and traction alopecia. Alopecia areata is an autoimmune disease where your immune system begins to attack your hair follicles, which is where your hair starts to grow. Alopecia areata, it occurs because your immune system unfortunately mistakes the hair follicle for a harmful bacteria or a virus. Now, traction alopecia, it happens when you have excessive pulling on the hair shaft. Traction alopecia, it occurs mainly in women and men with highly textured hair. This form of hair loss, it can occur when you have braids that are way too tight on your edges. The prolonged tension, it can cause the hair follicle to stop growing, inciting permanent hair loss. Putting your hair up in super tight ponytails or buns can also cause traction alopecia. You may want to become a cranial prosthesis specialist if you're interested in hair loss, alopecia, and other medical related issues. So, how do you get alopecia? There isn't just one way to get alopecia. Some other causes include hormonal or chemical imbalances within your body or external things such as hairstyles. Extreme stress can even ignite alopecia in some cases. When suffering from severe stress, specific systems in the body can actually shut down, which causes the hair loss. Other autoimmune diseases, such as cancer, can indirectly cause alopecia due to the chemicals used during chemotherapy. Pregnancy may also lead to alopecia. During pregnancy, your hair can become thicker due to hormonal changes. And about 2 to 4 months after giving birth, this hair then begins to shed as your hormones change again. This is commonly referred to as postpartum alopecia. Now, we're going to break down the different types of alopecia. Most people know of alopecia areata as well as traction alopecia, but there are also other forms of alopecia. Number 1 being alopecia totalis, which is a progressive form of alopecia areata that results in permanent hair loss. There's also alopecia universalis. This is the most advanced form where all of the hair on your body is lost, on the head as well as the legs and underarms. Androgenic alopecia, this is a form that is known as male or female pattern baldness. This type of alopecia is where your hair thins to the point where it almost seems transparent. It is genetic and also the most common form of progressive hair loss seen today. Like we mentioned before, postpartum alopecia. This is the temporary hair loss that occurs at the end of pregnancy. This form of alopecia is usually sudden and sometimes excessive, and it is caused by a hormonal imbalance due to giving birth. In the salon, I see many new moms experience postpartum hair loss, specifically around their hairline. Here are some symptoms of alopecia. The primary symptoms of alopecia is, of course, hair loss, but other symptoms may be present depending on the severity. Though hair loss is the primary symptom, patterns of hair loss may vary. Sometimes clumps at a time may fall out, or you may find strands on your pillow, or even several strands may fall out while you're washing your hair. Your fingernails and your toenails may actually become pitted from having alopecia. They may also change shape or color and may have a sandpaper texture. In some cases, a person's eyebrow hairs and eyelashes will also begin to shed as well. Now for the diagnosis. Alopecia is diagnosed through a physical examination and a look through your medical history. In addition, your doctor will also ask questions about your hair loss. They will look at patterns of hair loss on your scalp, as well as analyze your scalp. They may also conduct another test, such as a hair analysis and a blood test. During the hair analysis, the doctors will look at hair strands under a microscope and may even take a sample of your scalp. Now, Kayla, okay, we get it. Alopecia. How can we treat it? Alopecia, it may cause permanent hair loss. In other cases, the hair grows back within a year or so. Your physician may prescribe treatments and medications to aid in hair growth. In 10% of cases, the hair will never grow back. Permanent hair loss or damage, it occurs when you have a family history of alopecia, if you get alopecia before puberty, or if you already have another autoimmune disease such as lupus. There are no cures for alopecia, but there are treatments or remedies. One of the most common treatments that your physician will offer to you is injecting the steroid, corticosteroids, into your scalp or skin every 4 to 6 weeks. There's also topical corticosteroids, which is an ointment that's applied to the skin or your scalp. There's also minoxidil or Rogaine, which is the only FDA-approved drug for hair loss. Rogaine is an over-the-counter drug available in 2 and 5% formulas. Higher doses, they can sometimes cause facial hair growth, so doctors usually don't recommend this for women. You use it by massaging the ointment into your scalp twice daily, and regrowth usually appears within 6 months. However, the effects of this medication only last as long as you are using the product as directed. There's also another medication called finasteride, and they come in 2 forms, either Propecia or Proscar. This is another oral medication and it's used to treat alopecia. Most doctors prescribe it to postmenopausal patients because this drug is also used to treat an enlarged prostate. Increased hair growth is a side effect of finasteride. Proscar, it has a higher dosage and it is usually more efficient than Propecia. It is usually not given to the woman of childbearing age because this medication can sometimes cause cognitive disabilities. In addition, it slows down the hair loss by up to 75%. This medicine works as long as you are taking the medication. Next, we're going to discuss other forms of treatment. Lasers are an alternative for patients without success with minoxidil and finasteride. Some doctors will actually prescribe a laser comb, which costs between $100 to $800. This magic comb, it works to repair the damage, it helps stop and prevent thinning, and it also speeds up hair growth. The HairMax laser comb is the only laser comb that is FDA approved, but there are several other combs that you can buy much cheaper online and over the counter. You use it by gliding it through your hair for 15 minutes, and the results are usually seen within 6 months. Hair transplants are also used when hair loss is concentrated in specific areas. This operation is done by removing the hair follicles from a more dense area to thinning areas. But this procedure is rarely used because in most cases of alopecia, it spreads throughout the entire scalp. If you remember those Bosley commercials from back in the days, this company restores customers' hair through hair transplants. They actually create a personalized solution to restore your hair by transplanting healthy hair follicles to thinning areas in your hair. There are also thickening tricks that you can use to make your hair appear as though no loss has ever occurred. Some people choose to use specific serums and oils that stimulate hair growth. You can even create your own DIY mixture of oils rather than buying something from the store. Now, let's get into some alopecia hairstyles. Trying to cover up your hair loss with wigs and other low tension hairstyles is an option if you would rather wait for your hair to grow back instead of taking medications. However, while going through this transition, please remember, beautiful, your beauty does not only lie within your hair. It is important to remember that beauty is not only what's on the outside, but it starts internally first. And no matter your hair, you can still look and feel beautiful. But if your hair ever has you feeling down, girl, just treat yourself. Go out and buy a cute outfit or splurge on some makeup, or go out and buy those shoes that you've been wanting. These things will not cure or even treat your alopecia, but they will for sure help boost your confidence, which is especially important. But If you're looking for a way to hide your hair loss or you want a new look, here are a few hairstyles that will make you look and feel beautiful inside and out. The bald babe. Going bald is a very bold move. Women often hide behind their hair, and going bald definitely goes against society's rules. Going bald can boost your confidence as you learn to become more comfortable with yourself. The bald babe community is currently trending too. Celebrities from Sanaa Lathan and Jada Pinkett Smith are all shaving their heads and looking great. Going bald makes a very bold statement and it looks great on every and anyone. You can even accessorize with earrings, scarves, hats, and of course, a gorgeous face bead. You can also opt to use temporary color spray. The color spray is perfect if you have traction alopecia around your edges or if you already wear a short style. The temporary color spray, it has fibers that mirror your natural hair and it is perfect for men and women. This color spray is a natural temporary fix and you can buy this from almost any drugstore or beauty supply store near you. Our other styling option is going to be the TWA, or the teeny weeny afro. The teeny weeny afro is also perfect when you want a low cut or you don't want to be completely bald. You can even use temporary color spray on the less dense areas. This style is super effortless to maintain. It is perfect for anyone who does not want to invest a ton of time taking care of their hair. You can also opt for going natural. Transitioning to natural is a massive change when you've been relaxed for so long. Changing the way you do your hair is a big decision and it should be well thought out before taking any action. Though you may be crying over losing your lane, it will be worth it in the end, trust me. In addition, if you're suffering from damaged or overprocessed hair, going natural may actually help to treat your alopecia. Relaxers, they can cause alopecia because in some instances, these chemicals in the relaxers, they can make your hair thinner or weaken your hair shafts. Even if your hair remains thin after going natural, it will be easier to hide balding or thinning areas with your natural hair. Throughout the transitioning process, you want to take extra good care of your hair to help stimulate hair growth and prevent more thinning. You can also try switching up your part. Thinning parts are usually one of the first signs of alopecia. A thinning part is when you notice fewer hair strands where you usually part your hair. An easy way to combat this issue is by alternating your part. For example, if you're used to the middle part, you can switch it up to a side part for something new. You also can get bangs or you can even put your hair in a ponytail. There are even some root touch-up products that will make your roots appear fuller. Of course, wigs are always an option. Wigs are a hot item right now and one of the most convenient protective styles. A wig is super perfect when you're trying to hide your hair loss. Wigs give the illusion that you have a head full of hair and they provide the same versatility. You can cornrow your hair and easily treat the affected areas with oils or ointments. And the best part is that the wigs come in a plethora of options. You can get version, crochet, and synthetic wig. You can even get a half wig or a 3/4 wig. These wigs actually allow you to leave your natural hair out. Half wigs, they usually lay from the crown of your head to your nape. There are also U-part wigs. U-part wigs and half wigs, they come in synthetic as well as in human hair with several different color options and textures that look similar to how your natural hair looks. You are not only limited to wigs that mirror your natural hair, but you can also get wigs that have cornrows, single braids, faux locks, and twist hairstyles. The options are literally endless. The best part about a wig is that you can take it on and off every single day to treat your alopecia daily or as directed by your doctor. We can also opt to get a weave. Weaves are another great protective style many people use to grow their hair. You can create a preferred braiding pattern and attach a netting weave cap. The net is going to create a barrier between your natural hair and the tracks, preventing any damage to your natural hair. Using a netting cap also will enable you to keep your sewing in longer, and there are even caps infused with oils to help keep your hair hydrated in the process. You can have leave out if you're not comfortable with wearing a closure or a frontal just yet. Frontals and closures are really great options though, because they allow you to cover and protect your hair and they offer maximum styling versatility. You can also try crochet braids. This style is perfect when you want single braids, but you don't want the added tension to your hair or your edges. The best part about crochet braids is that they come in several different colors and textures, making it possible to achieve almost literally any hairstyle. Some styles, they include box braids, Singalese twist, faux locks, jerry curls, and many other options. If you suffer from alopecia in the center of your head and you want braids, some hairstylists will create a single braid along the perimeter of your head, and then they're gonna cornrow the center and add the crochet braids so that your braids can still appear to be full. Ponytails and buns. These are also super easy and cute styles that you can achieve. These styles are also perfect for any occasion, from going to the gym to even a fancy dinner. And if you want a longer ponytail or a ponytail of a different texture, you can always add a clip-in ponytail or a bun. Or you can even add tracks within your clip-ins to add extra fullness to your hair. When you're doing a ponytail or a bun, you want to make sure that you do not pull your hair too tight, okay? Because this can cause your edges to become even weaker. But if you want a sleeker look without the added tension, you can always use a gel or edge control to have your updo looking snatched, honey. Then we have the camouflage cornrow hairstyle. This style will make it look like you have not lost a strand of hair ever. You may need a professional to achieve this style, but it always looks so bomb. Hairstylists created the camouflage cornrows for women who suffered from alopecia or hair loss, but still want to achieve specific cornrow styles, such as straight backs, and more intricate styles, such as the lemonade braids, braids going into a bun, or even braided ponytails. Hairstylists, they achieve these looks by braiding the cornrows very close together and then stitching them to ensure that the braids stay in place. Clip-ins and tape-ins are also a great option. This is a great way to add extra volume to your natural hair. These are perfect if you're uncomfortable wearing a weave or a wig. You can apply it easily to disguise your thinning areas. Tape-ins and clip-ins come in different colors and textures. And if you cannot find your exact color, you can always color your clip-ins as long as you purchase some clip-ins or tape-ins made of human hair. I just wanted to add in there, if you're experiencing severe hair loss, tape-ins and clip-ins may not be the best option. Now, this one is for my girls who love to accessorize. You may be thinking, what if I don't want to wear a wig or a weave? What are my other options? Do not worry, you are not out of options. You can still hide your thinning spots by just using accessories. You can channel Rihanna's Wild Thoughts vibes with a super cute scarf, or you can cover up your whole head with a faux bun in the front or the back. But please, don't be mistaken. Scarves should not only be worn to sleep. The girls are literally slaying in scarves as an everyday look. Another way to completely cover your hair is by wearing a hat. Hats are a perfect accessory for working out or hanging out with friends. You will also be surprised how a hat actually complements even a more formal outfit. Headbands are another great accessory. You can brush your hair back, which can help to hide your bald spots, and add your favorite jewels or subtle headband. These accessories, they don't work for every circumstance, but they are super helpful when you need a quick fix. We know that hair loss, especially alopecia, can be stressful and feel overwhelming. So we send love, confidence, and support if you are on this journey. Thank you all so much for watching. Hopefully these tips can help ease some of the stress and let you know that you are not alone. Do you know some creative and helpful ways to combat hair loss? Or even some cute hairstyle ideas and confidence boosting tips? Please, we would love to hear them in the comments below. Help a sister, help a sister. If you enjoyed this video, please show us some love by liking and subscribing. Also sharing this video with all of your nearest and dearest friends and family. And please make sure you all tune in to the next video. I cannot wait to talk to you guys again. Peace out.